Karen Whitsett is a state representative in Michigan. She began experiencing coronavirus symptoms in mid-March and then went way downhill. For 2 weeks, she said she felt no better, and then on March 31st, she was prescribed hydroxychloroquine. Within hours, she says, she began improving. Now, Whitsett, who's a Democrat, credits the president with saving her life by bringing attention to that anti-malarial drug. Representative Whitsett joins us tonight along with her physician, Mohammed Arsawala. Thank you both, Representative and Doctor, for joining us tonight. First to you, Representative Whitsett, just describe quickly, if you could, your experience. You're very sick, critically sick with this virus. You took this drug. What happened?
First, thank you for having me on. I really appreciate this opportunity to share my story. Well, very quickly, just a real brief synopsis of it is that I was spiraling downhill. I had sweats really bad. A headache that I just could not get off. Really a problem with my throat. I didn't have body aches, but my neck was really bad, and I just did not feel right. My eyes were getting smaller, and I just did not feel right. So I did contact Dr. Arsawala, and Dr. Arsawala did listen to me.
So I'm just so interested because you're a politician. Obviously, you know politics. That's what you do. Are you surprised that this drug, this medicine, which helped save your life, you say, has become a political issue?
I'm actually not surprised that it's become a political issue. There are so many politics and policies surrounding medicine, medication, medical equipment. This is actually a norm. That's why we do have health policies and have people on these committees. I have Lyme disease, so I've been fighting for Lyme disease policies within my district, within my state since I started this in office. So I'm not surprised at all.
Right. Well, you make a fair point. Dr. Arsawala, you apparently prescribed this drug to the representative. Why did you do that? Do you credit this drug for helping her, and do you prescribe it to others?
Yeah, thank you, Tucker. We've had so far in our practice about 56 cases of the COVID-19, and of the 56, we are prescribing this to the patients who have moderately severe illness, and those conditions where this is kind of a spectrum of patients that we are prescribing that are not really very sick to be admitted in the ICU. And so we are trying to prevent these patients, these small group of patients. Out of 56, only 12 of them got this medicine, and Karen was one of them, that very sick patients who are going to get those symptoms of chest tightness, a cough and congestion and fever. And we are trying to prevent these sicker patients who have underlying medical problems, like the one that Representative Karen has, it of Lyme disease, that make it worse. And these conditions, we are treating it with 2 antibiotic and 1 anti-malarial medicine, which is hydroxychloroquine. And these medicines right now, first of all, we don't have really good treatment strategies for COVID-19. All the medicines that we are using are mostly experimental or anecdotal. So we are ending up with very limited, spectrum, and we don't have much in our armamentarium. But it seems to work. The Zithromax, which is an antibiotic, seems to work because of the antioxidant effect. And also, I think the hydroxychloroquine, interestingly, it is also not only just used for the malaria medicine, but we are forgetting that this medicine actually is a disease-modifying agent that is used in treatment of chronic rheumatoid arthritis, polyarthritis, and individuals who have chronic arthritic diseases. This helps a great deal. So I think what it is doing is that it's reducing the inflammation when the virus is really playing havoc in people's body. So I think this is very important clinically right now to look into it. I think FDA and a lot of other institutional organizations have started research into it.
Apparently they have. Doctor, thank you for joining us.
Well, it did save my life, and I do credit the president to doing so and putting this out there, because it wasn't accessible to me if it wasn't for that fact.
Yes.
I had very little time to be able to get to this and be able to make a choice, because my breathing did become very labored.
I just find it amazing that you're saying that out loud, and I appreciate that you are, because this isn't about politics, it's about saving people, and And you obviously know that. Thank you very much.
Pull over politics.
Amen.